Hello, my name is Nicole Weber and I signed up to do rugby. Here is a quick clip on how to do a squat and a plank to allow for strengthening of your quads and strengthening of your core for stability. So one example to really help stretch the hip flexors is a forward lunge. So what you're gonna do is step out, lunge down, make sure your knee is not over your toes, and lean into it. And you really feel that stretch in your leg that is behind. To stretch out your chest and your shoulders for just making sure you're loose is called a chest and shoulder stretch, which most of the time you can do it at the same time, but you can also do it one at a time. So you go up to a wall, you'd line your elbow up and really lean into it and lean outward. You really want to feel that stretch right in this area. And then you can switch arms. The most common acute injury that occurs in rugby is bruising, because they play a sport that requires no gear and they deal with a lot of head-on collision to the body and the head. The most common chronic injury that occurs in rugby is tendonitis in the knees and ankles, which is caused just by the constant running that they have to do. Is to prevent acute and chronic injuries in rugby is to use proper technique for tackling and sidestepping, making sure to train programs and drills for coordination, strengthening, balancing, and flexibility. Also, try to wear protective gear during practices, like a mouth guard or a helmet or a headwear of some sort. And then for ankles, to help with chronic injuries, you can tape your ankles to allow support. Making sure to stay hydrated is a very big deal just in general with life, to make sure you're healthy. But for a sport that's doing a lot of cardio exercise, especially out in the heat and different climate conditions, it is very important to make sure you are hydrating and drinking enough water every single day and eating enough food, because if not, it won't allow your muscles to heal properly and you won't be able to perform at your best in practice.